Speakers are asked to limit their comments to 5 minutes today, because we have 2 speakers. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation to bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of these claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Thank you. Can I get a motion to accept the agenda before us? Thank you. All in favor, say aye.
Aye.
Any opposed?
Aye.
Motion's carried. Can I get an approval of the minutes of the meeting on July 29th, 2025?
So moved.
Second.
All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much. First up is our board reports, and we have none. So next, I think my speaker just went out. David Verinder, our CEO, to go over the Excel Award winners.
Thank you, Madam Chair. I am privileged to announce 2 different Excel Award winners today, and I'm going to invite first our July Award winner, Dan Heltzer. Dan, come on up. Congratulations. I'm going to say some kind things about you, Dan. Okay? You will receive. So Dan is a staff chaplain in our spiritual care services. His colleagues say that Dan truly excels in his duties as a chaplain. He visits our entire SMH campus, providing support and prayers for patients, families, visitors, and staff. He rounds on every unit, even if he's not consulted, to check and see if he can be of any assistance. He takes care of everyone. Staff also say that Dan has a calm, empathetic demeanor, and his presence is incredibly comforting, even when you see him in the elevator. He always goes above and beyond to make the staff and patients feel better. Dan also helped establish the Veteran Honor Program and has performed multiple honor ceremonies for veterans in our ICU during their final hours, and families have been so grateful. Dan, we can't thank you enough. On behalf of our community, our patients, our hospital staff, for everything that you do. Thank you.
Thank you.
Would you like to take it away?
Thank you so much. If I could just speak briefly about our Veteran Honor Program. Today I had the privilege of meeting a 101-year-old World War II veteran.
Wow.
in 4th floor rehab. He trained fighter pilots to go over into the Pacific Theater. He had all of his mental faculties at the time, and he was able to share with me wonderful stories of what he was able to do, accomplish, and experience throughout World War II. So we were able to invite about 20 of the personnel from 4th floor, IRF, and they filled that room, and tears flowed, and he was honored in a very special way today. So thank you for allowing me the opportunity to do that.
Thank you. That's good.
There you go. There's your Excel Award winner, comes up and talks about what he did for patients today.
Great.
So, I would also like to introduce you to our August Excel recipient, Jody Walsh. Jody, where are you? I'm going to say some nice things about you too. It's easy. Jody Walsh is our outpatient benefit coordinator and patient registration. Her peers say Jody is known for her incredible expertise and her warmth, wisdom, and kindness. When staff reach out to her and her colleagues, Jody goes the extra mile to support patients and our team, and she always remains cheerful and positive despite the difficult situation. Jody cares about the well-being of patients and their families and is always willing to help find solutions for individuals facing financial barriers. Whenever a team member needs help, she's the go-to person to take the time to answer questions and resolve concerns. She exceeds everyone's expectations. And Jody, thank you for everything that you do, once again, for our patients, our community, and our staff. Thank you.
Thank you very much. I feel very honored. I have worked with many of you for years and years. I've been here about 24 years in total, 7, and I couldn't stand it. I had to come back after 3. I have seen many changes throughout the hospital, many different changes, and I want to let you all know that it is an honor working here. So I thank you all for the reward.
David, and thank you, Dan and Jody, for all you do. We appreciate you. Next up is our medical staff reports. Dr. Fiorica.
Yes, today I'm asking for a motion to approve the SMH system policy expedite proctoring process as recommended by the SMH Sarasota and the SMH Venice Medical Executive Committee.
So moved.
Can I get a second? Second. Okay. All in favor, say aye.
Aye.
Any opposed? Motion passes. Great. Thank you so much. Dr. Hurwitz.
Thank you, Madam Chair, members of the board. Good afternoon. Today, I'm asking for a motion to approve the SMH Sarasota policies, guidelines, procedures, and forms that include the SMH Sarasota Infusion Center and the SMH Sarasota Advanced Practice Provider Transition of Care Privileges, outpatient clinics, and pre-admission testing policy, all as recommended by the SMH Sarasota Medical Executive Committee.
So moved.
Can I get a second? All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much. And next up, Dr. Perrin.
Thank you, Madam Chair. Sorry, get the microphone here. I'm asking today for a motion to approve the SMH Venice policies, guidelines, and procedure forms related to the SMH Venice APP transition of care privileges, outpatient clinics, and pre-admission testing as recommended by the SMH Venice Medical Executive Committee.
So moved.
Can I get a second? Second. All in favor, say aye.
Aye.
Any opposed? Thank you, Vic. Motion passes. Thank you so much to all 3 of you. Next up is our secretary's report. Patty Moran.
Good afternoon, everyone. Okay, board calendar, October 25th, Tuesday, October 28th, 2025, 9 to 9:30 closed session, hospital board meeting. 9:30 to 10:45 is the quality committee. Meeting 10:45 to 11 is SMH Physician Services annual meeting, and 11 to 12 is the educational workshop, First Physicians Group update. On Tuesday, November 18th, 2025, board annual meeting, which is the 3rd Tuesday due to Thanksgiving is the following week. 9 to noon is the Governance Effectiveness Committee. Noon to 12:30, closed session, hospital board meeting. 12:30 to 2 is the board lunch and issue and financial review. And 2 to 4 is the public board meeting.
Okay, thank you so much.
Thank you.
Appreciate it. Next up is Kevin Cooper with our treasurer's report.
Yes, thank you, Madam Chair. We have one item under today's agenda, which is the approval of bad debts and charity care. And so I would move approval of the bad debts and charity care for the month ended July 31st, 2025 in the amount of $35,525,000. And for the month ended August 31st, 2025 in the amount of $33,409,000.
Okay, can I get a second?
Second.
All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much. Appreciate it. Next up is Jen Rosati for our financial highlights.
Good afternoon. Today I'm going to present the financial results for the month of August 2025, as well as the 11 months ended August of 2025. Total revenue for the healthcare system month to date, our actual results, $201,805,000 versus a budget of $175,107,000. On a year-to-date basis, $2,020,378,000 for our actual results versus a budget of $1,930,645,000. Our total expenses for the month of August, $169,251,000 versus a budget of $168 $1,917,000. Fiscal year to date, $1,808,088,000 versus a budget of $1,831,379,000. Our operating income for the month was $32,554,000 versus a budget of $6,190,000. Our monthly operating margin was $16.1 million versus a budgeted operating margin of 3.5%. Fiscal year to date, our actual results, $212,290,000 for our operating income versus a budget of $99,266,000. On a year-to-date basis, our operating margin is 10.5% versus a budgeted operating margin of 5.1%. Our August year-to-date statistics, our average daily census, actual results of 930, which comes with an average acute length of stay of 4.45 days versus a budget that was for Sarasota, and then the actual acute length of stay for Venice of 3.69 days, and the budgeted average daily occupancy is 941. Our admissions and observation cases, actuals on a year-to-date basis, 79,087 versus a budget of 77,550. Continuing with our year-to-date statistics, our surgery cases, actual results, 31,382 versus a budget of 31,845. And births, our actual results, 4,401 versus a budget of 4,604. Continuing with our year-to-date statistics, our outpatient registrations, 556,958 versus a budget of 555,364. And our emergency care registrations, our actual results for these 11 months, 164,341 versus a budget of 163,503. And the last slide here is our case mix index. For Sarasota CMI All, 1.89 fiscal year to date. Sarasota CMI Medicare, 2.0 fiscal year to date. Venice CMI All, 1.47, and Venice CMI for Medicare, 1.48. And that concludes my report.
Thank you so much. I appreciate it. Next up is our committee reports, and today we had mission and planning, and Sharon DePeters will be reading her report right now.
Thank you, Madam Chair. So the Mission and Planning Committee met this morning. There were 2 approvals and 1 update presented to the board. In the first presentation, Maria DiCarlo, Vice President of Post-Acute and Rehab Services, and Jan Vera, Chief Financial Officer at SMH Venice, presented on 2 opportunities for inpatient rehab expansion across the system. The first proposed inpatient rehab expansion project is at SMH Sarasota and includes adding 7 inpatient beds and the necessary support space. The expansion is expected to begin with the current occupant. The SMH Infusion Center moves into the Cancer Pavilion in the spring. The beds will open for patient care in January of 2027. I move for approval of project amount not to exceed $5,600,000 to renovate 5 South at SMH Sarasota, which will expand inpatient rehab services by 7 inpatient beds and the necessary support as recommended by the Mission and Planning Committee.
So moved.
Can I get a second? Second. All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you.
Thank you, Sarah. The second inpatient rehab expansion opportunity is building a rehabilitation pavilion at SMH Venice. The proposed pavilion will include 50 inpatient rehab beds, outpatient rehab services, rehab administration, and shell space for future growth. The pavilion will be seamlessly connected to SMH Venice for optimal efficiency. The rehab pavilion is expected to open in January 2028. I move for board approval of the project amount not to exceed $82,500,000 for the proposed rehab pavilion at SMH Venice as recommended by the Mission and Planning Committee.
So moved.
Okay. Any discussion, or sorry, all in favor, say aye.
Aye.
Any
Aye.
opposed? Okay, motion passes.
Thank you. Next, David Patterson, Associate Chief Nursing Officer, prevented on the hybrid operating room 22 renovation at SMH Sarasota. The OR has met its useful life and will need to be updated with new construction and equipment to ensure the room can continue to meet the existing volume and expected future growth. I move for approval for the purchase of new equipment and the renovation of OR 22 with a total project cost not to exceed $4,400,000 as recommended by the Mission and Planning Committee.
Okay, any discussion? Okay, all in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much, Sharon. Oh,
The final presentation was given by Pam Ramhofer, Chief Information Officer, and Dr. Joseph Seaman, Associate Chief Medical Officer. And it was an update on the EPIC project. The project is progressing on time and on budget. SMH plans to go live with the new enterprise EHR in October of 2026. And that concludes my report, Madam Chair.
thank you so much. Next up is our President and CEO, David Verinder.
Thank you, Madam Chair. I am happy to give you our monthly report. And I'll start like I do each month with our organizational report card. And if you look with us, you'll have seen this many times, but we have on the left-hand side the 5 different areas that we are areas of concentration: service, people, quality, finance, and growth. In the middle column, we have our goal for each of those. And then finally, on the right-hand side is our score or rating. So the first one up is in the area of service. And we are the part we measure for this is our likelihood of recommending having our number of service areas equal to or greater than the 75th percentile. Our goal is to have 8 out of 10 of those be at that. Happy to report we are at 10 out of 10, and I'll show you the details here in a minute. In the area of focus of people, our goal is to have our new hire retention percentage of regular and full-time employees that are hired within the fiscal year 2025 that are still employed as of September 30th, 2025, which is in about 5 days, be at 83% or higher. Happy to report that we did exceed that goal, and we're at 87.12%. In the area of quality, we have our goal is to have our infection prevention, which is our combined overall standardized infection rate, be less than 0.8. Happy to report that we are exceeding that at 0.55. And just to remind the board and the public that 1.0 would be a national average. So we already set our goal pretty low to that, and we're doing extremely well compared to that. In the area of finance, we have our goal of meeting our operating margin budget, which is set at 5%. As you heard our CFO, Jen Rosati, present just a little bit ago, we are currently tracking at a 9.9% operating margin for the year. And finally, in the area of growth, we have 2 indicators. The first being our inpatient admissions and observation outpatients being at 82,000 or higher. Happy to report we are exceeding that at 85,800. In the outpatient registrations, we have a goal of being at 1.2 million for 1.225 for the year. We are exceeding that as well at 1.324 million. So looking at the next page at the detail on the likelihood of recommending, just to orient you once again, the likelihood of recommending, these are the 10 areas that we survey. on the left-hand side. And the middle score is our score of what we have for this fiscal year. And if I did mention, the fiscal year does end 9/30, so we're just about there. Next one over is the national median score, and then finally on the far right is the 75th percentile score. And I'm happy to report that we are hitting all 10 out of 10 at the 75th percentile or higher, which is a great accomplishment for our staff. So thanks to everyone who made that. Next up, we had SMH was ranked number 1 in the nation for preventing hospital readmissions of heart bypass surgery patients. Sarasota Memorial has been ranked number 1 in the nation for preventing readmissions among heart bypass patients, according to Becker's Hospital Review, with federal data showing SMH has the lowest rate of unplanned hospital visits following a CABG surgery for all hospitals evaluated. SMH had the nation's lowest readmission rate of 7.8% for CABG patients, which is significantly lower than the national average of 10.6%. CMS reports that readmissions following surgery can often be prevented with high-quality inpatient care, which keeps patients from returning to the hospital and reducing their stay length if they have to come back. So congratulations to our heart team. Sarasota Memorial was named one of America's best physical rehab centers. Sarasota Memorial was recently named one of America's best physical rehab centers by Newsweek, a recognition that places our rehab pavilion among the top in the nation for inpatient rehabilitation care. Inclusive on this list shows that the SMH delivers superior outcomes and care based on an evaluation of quality measures, accreditation, and feedback from the medical experts and patients. At Sarasota Memorial, patients benefit from a hospital-based team of specialists that includes physicians, physical, occupational, and speech therapists, and specially trained and certified rehab nurses and technologists who provide tailored therapies to restore function, mobility, and quality of life. Congratulations to our whole team there. And thank you for approving the new one. Sarasota Memorial was named to Newsweek's list of the world's best smart hospitals in 2026, earning international recognition for its leadership in health technology and innovation. The ranking highlights 350 leading hospitals across 30 countries that excel in digital health tools, including artificial intelligence and robotics. Hospitals were evaluated based on peer recommendations, surveys, and accreditations from organizations such as the Joint Commission. SMH was specifically recognized for our use of robotic-assisted surgery to enhance patient outcomes, virtual reality use in simulation and education, and upcoming system-wide transition to Epic electronic health record in 2026, and AI used to streamline clinical workflows. Sarasota Memorial has once again been recognized as one of the best employers in Florida, earning a spot on Forbes' 2025 list of America's best in-state employers. This marks the third consecutive year SMH has earned the recognition, which highlights organizations that prioritize employees' well-being, job satisfaction, and workplace culture. The 2025 ranking evaluated employers from all industries with at least 500 employees and was based on more than 160,000 employee surveys. Sarasota Memorial also ranked among the top 3% of America's best employers for women for 2025, ranking number 22 out of 700 companies spotlighted. More than 140,000 women working for the companies with at least 1,000 employees provided feedback on their employers' culture, opportunities for career development, salaries and benefits, and other working conditions. In addition to placing number 22 overall, SMH placed number 9 in the healthcare sector. So congratulations to our team. And finally, two of our first physician group cardiothoracic surgeons were recently named to Newsweek's 2025 list of America's leading doctors. Jonathan Hofberger is a director of our minimally invasive cardiac surgery at SMH, ranked number 20 in the nation for cardiothoracic surgery, earning top ratings for heart valve surgery and coronary artery bypass graft surgery. Dr. Jeff Sell, Chief of Cardiothoracic Surgery at SMH, earned top ratings in coronary artery bypass graft surgery. Rankings are based on a combination of physician performance data, peer recommendations, quality care assessments, and board certifications. And we'd like to congratulate and thank both of these two physicians for working here and trusting us with their patients. And that is my report. I'm happy to answer any questions.
Does anybody have any questions for David? Okay, hearing none, thank you so much. We'll move on to the public comments. Because we have two speakers, comments will be limited to 5 minutes, as I mentioned earlier. Commenters, please remember the rules of civility that you agreed upon before entering the meeting today. I will not interrupt you during to warn you about the permitted time, but I will let you know when your time is up. You can also see the allotted time on the screens as you're speaking. With that said, the first speaker we have today is Saul Kilstein, followed by Lisa Roulette.
Hi, everybody. Saul Kilstein. I've been here before, but for those of you who don't know me, I'm a full-time resident of Sarasota. I'm also a repeat patient, non-oncology outpatient in your outstanding oncology tower. I wanted to say that because I think it gives you some credibility to the importance I place on my coming here every time to tell you how much I value the system. It might surprise you that I'm not here today to repeat the threats I believe come from Secretary Kennedy's declared war on vaccine science, the CDC, and FDA. I'm also not here today to detail the consequences of Surgeon General Latipo's declared intention to eliminate vaccine mandates for school-age children, disparage the importance of vaccines, and then leave it up to parents to decide whether or not to vaccinate their children. I'm also not here to tell you that there's a large possibility that Medicaid coverage is going to be reduced and the number of people with subsidized health insurance is going to decline, and what that's going to mean for uncompensated care for your system. I shared with Ms. Rosati the potential impact that will have on the budget, which already, as you heard today, has something around $30 million of uncompensated care. That's around $350 million a year in this projected budget. What's it going to mean when that goes up? The thing I wanted to talk about is, and I'm not a public health specialist, but I think about it in terms of vector analysis. What are the consequences of less immunization in a population like Sarasota with about 37% of the population elderly and 15% uninsured today coming into your health system? What's it mean in a case where Florida is a national and global mixing bowl of travelers? You have some of the largest airports, 6 of the major airports in Florida are near Sarasota, with something like 150 million people traveling through Miami, Fort Lauderdale, Tampa, the largest airports in Florida, a mixing bowl going through to Disney World and all the beach areas. Not only that, you have 4 of the largest ports with 21 million people, including our own residents, coming back and forth. Now take that. Are you thinking about Florida being a petri dish? The unvaccinated kids, measles, potentially polio, all of the pediatric vaccines not being given to what? 10% of the population already not being vaccinated, going up to 20%. Are you planning for this? What if you have 100 measles cases? Multiply that by the petri dish of all these airports, the unvaccinated working population going back to work, the elderly relatives living with these families and coming through the ports of entry. unvaccinated American and international tourists. What I'm saying is this worries me. I hope you're planning for it and share my concern. Thank you. And I hope these are going into your strategic planning and you're thinking about it. Thank you very much.
Thank you. Next up is Lisa Roulette.
For almost 3 years, I have been urging our 9 hospital board members to call for policy changes that are necessary so patients are protected from preventable harm, which is undoubtedly occurring here in situations where FDA, CDC, and NIH guidance run counter to the foundational principle of medical ethics, first do no harm. I sent each of you a list of 5 important questions that have gone unanswered by almost all of you, summarizing some of the top patient safety concerns that I and others have observed here. The vast majority of you have shown absolutely no interest in answering these questions or addressing these problems. The questions are very basic. Answering them should be a point of pride. The fact that 8 of 9 of you have failed to answer them is revealing and alarming. Here are the questions that I asked that almost none of you have responded to. Number 1, based on my and others' observations, Sarasota Memorial is allowing patients to be exposed to preventable harm here in certain situations. Has Sarasota Memorial lost first do no harm as its foundational policy? What policy could possibly be more important than this? The vast majority of you have not answered that basic question. Number 2, would you like Sarasota Memorial to show patients the part in the hepatitis B vaccine product insert that shows that their newborn babies will be injected with aluminum and that the pre-licensure clinical safety trials only tracked injury and death for just 4 to 5 days? Number 3, I can easily show you that the use of 4-point restraints on Dr. Gafanti for 5 hours was unjustified and unconscionable. But most of you refuse to even meet with me or with him so we can show you this. Why do the vast majority of you seem to care so little about what appears to be heart-wrenching patient mistreatment? Number 4, Dr. Pierre Corey has been welcomed multiple times at U.S. Senate subcommittee hearings, but he and his life-saving expertise have been rejected at Sarasota Memorial. This is internationally acclaimed life-saving knowledge that includes expertise in the topic that has caused our community so much death and so much pain: COVID. If you were one of the 8 who rejected his offer to share his expertise with you about this and about many other vital topics, what is your reason? Number 5, congressional testimony and expert analysis have confirmed that the mRNA COVID vaccines are cardiotoxic and biotoxic. Do you agree with this? Do you think it is important for you as a board member and for Sarasota Memorial as a hospital system to understand if this is true? After almost 3 years, I have concluded that the vast majority of you simply don't care nearly as much as you should about protecting patients in these situations, at least not enough to fight for them. I haven't lost hope that you will answer these questions and do the right thing for the patients who place their trust in you, from the littlest newborns to those who are facing their end days. I urge you to reach out, answer these questions, and address the problems. Thank you.
Thank you. Having completed our agenda at this time, we have no legal matters, and so meeting will be adjourned.